Hi everyone, I am Kyla Lingwahe and today I will be performing perineal flushing return demonstration. Perineal flushing involves cleaning the genital area of the patient in the perineum. This is done for the purpose of removing perineal secretions and odors, prevention of infection and contamination, and to promote client's comfort. Now, prior to the conduct of the procedure, I have already prepared the necessary equipment needed to conserve time and energy. So I have here a bedpan, a cotton ball soaked with cleansing solution, and a dry cotton balls. I also have here my working forceps and my pickup forceps. And I also have two kidney basin, assuming that this is a kidney basin. I also have here my perineal pad, assuming that this is a perineal pad, and my working gloves. And also I have here my pitcher with warm water, assuming that this is a pitcher. Now I already performed hand washing to protect myself and my patient as well from infection and cross-contamination. Next is I am going to introduce myself to my patient, verify my patient's identity, and to explain the procedure to my patient to gain her trust and full cooperation. So, hi ma'am, I am Kyla Lingwahe and I am your student nurse for today. May I see your wristband please? Please state your name, your birthday, and your age, ma'am. Alright, thank you. So today, ma'am, we will be doing perineal flushing. So basically, I am just going to wash your genital area so that later you will feel more comfortable and refreshed. Will that be alright with you, ma'am? Alright, thank you. So before we begin, I am just going to close the door so that no one from the outside will be able to disturb us while doing the procedure. Okay, ma'am? Alright. Make sure to close the door to ensure client's privacy. Now, after doing so, place the client into a dorsal recumbent position. So, ma'am, I need you to flex your knees. And I need you to lift your buttocks so that I can place a bedpan underneath. Okay, ma'am? Okay, I will help you lift your buttocks in count of 1, 2, 3. Now, after doing that, I am going to wear my working gloves. Now that I'm done wearing my working gloves, I am now going to start with cleaning the genital area of my patient. So now I am going to expose the genital area of the patient. Make sure to expose only the area to be cleansed to prevent the client from having chills and getting embarrassed. So ma'am, I am going to expose your genital area, ma'am, ha? Next is I am going to pour a warm water over the genital area of the patient. So ma'am, I am going to pour a warm water over your genital area, ma'am, ha? So as I was doing that, I am also inspecting the genital area of the patient, noting for any particular areas of swelling, inflammation, excessive discharge, presence of odors, and also I am using a warm water because warm water will soften and soak the blood clots if there is any. And also it prevents the client from having chills. Okay, now I am going to grab my pickup forceps and I am going to pick up a cotton ball soaked with cleansing solution and place it here in my kidney basin. Now, using my working forceps, I am now going to start cleaning the genital area of the patient, starting from the midline down, from the symphysis pubis down to the anus. Discard. Then get another cotton ball and clean the labia majora, starting from the mons pubis down to the anus. Discard. Then, get another cotton ball and clean the labia majora of the opposite side. Starting from the mons pubis down to the anus by way of figure 7. It is important to remember that as we do that, whenever we trace the stroke, for us to prevent contaminating the cleansed area. Next, another cotton ball for the labia minora from the mons pubis down to the anus. Discard. Then get another cotton ball and then do the same way to the opposite side. Then discard. Then get another cotton ball to clean the groin area of the patient. Discard. Then get another cotton ball and do the same way to the opposite side. Discard. Now after doing that, I am now going to pour a warm water over the patient's genital area again to cleanse the genitalia. So ma'am, I am now going to pour a warm water, ma'am, ha, over your genital area again. Now I am going to use my pick up forceps again and pick up a dry cotton balls and place it on the other kidney basin. Now using my working forceps again, I am going to grab a cotton ball and start drying the genital area of the patient, starting from the mons pubis down to symphysis pubis down to the anus. Discard, then get another cotton ball for the labia majora from the mons pubis down to the anus by way of figure 7. Discard, then get another cotton ball and do the same way to the opposite side. Discard, then get another cotton ball for the labia minora. Discard, then do the same way to the opposite side. Then discard, then grab another cotton ball for the groin area. Then discard, then grab another cotton ball and do the same way to the opposite side. Then discard. Now after doing that, I am now going to take the bedpan. So ma'am, I am going to take out the bedpan underneath, so I need you to lift your buttocks again, okay? Alright, so 1, 2, 3. Alright, thank you ma'am. Next is, I am going to clean the buttocks area of the patient. So ma'am, I need you to lift to your I need you to turn to your right so that I can clean your buttocks area. Okay, ma'am? Okay, ma'am, I will help you in 1, 2, 3. Now, I am going to grab a dry cotton ball, and start drying the buttocks area of the patient. Discard, then get another cotton ball and do the same way to the opposite side. Discard. Okay, ma'am, you can lie down to your back again. Now, after cleaning the buttocks area, we are done with cleaning the genital area. So we can also use an antiseptic spray if they we can also use a antiseptic spray as needed. And also, I am going to put a perineal pad over the genital area of the patient. So ma'am, I am going to put a perineal pad over your genital area, ma'am, ha? Assuming that this is a perineal pad. Now drape the patient. Alright, so now that we're done doing the perineal flushing, ma'am, how do you feel right now? Are you feel more comfortable and feeling refreshed? Okay, so that's good to hear, ma'am. So now I am going to leave you here so that you can rest. And if you need anything, you don't hesitate to push the call button so that I can come back here and attend to your need. Okay, ma'am? Alright, so thank you so much, ma'am, for your cooperation. So now that we're done doing the perineal flushing, I am now going to do the aftercare of the equipment that I used, and also to document the the procedure that I had just done. So thank you so much.